Welcome, everybody. We are live at the Senator Mike McGuire's press conference, Tackling Addiction, Expanding Mental Health Care.
Well, good afternoon. How's everybody doing? Woo! That's what I'm saying. First of all, I want to say thank you. Thank you all for being here today. Thank you for your incredible work and making today a reality. We are so excited to be with you. My name is Mike McGuire, and I am forever grateful to have the honor of a lifetime to be able to represent the North Coast and the California State Senate. Before we get into today's remarks, which is a historic day for all of the North Coast, there are some really important folks I'd like to be able to introduce and say thank you to personally. First of all, I'd like to be able to introduce those members of the Board of Supervisors who are here today. First of all, we have our chair, Madam Chair, Ms. Bushnell. Round of applause, please. Supervisor Arroyo, ladies and gentlemen. Supervisor McGuire is in the house, my goodness. And Supervisor Wilson, thank you all for being here. I'd like to take a moment to thank the hardest working sheriff in California, Billy Hutson. Madam District Attorney, who works just as damn hard. Can we give it up for Stacy Keys? Representing the Arcata City Council, can we please give it up for Kimberly White, ladies and gentlemen? Stacy Atkins Salazar, ladies and gentlemen. Eureka is in the house. Mayor Burgell. So much to Councilwoman Renee Contreras-Deloach, who is in the house. Thank you so much. Councilmember Leslie Castellano is here. Thank you so much. Councilmember Hernandez Mario, it's wonderful to see you. Thank you. Representing the city of Rio Dell, we have Mayor Rio Dell, Deborah Barnes. In the and I saw Amanda Carter. Thank you so much. Representing the city of Trinidad, can we please give a round of applause to Mayor Kelly in the house today? I hope that you will agree with me, especially in rural California communities. People facing acute mental health crisis often find themselves without services during their greatest time of need. Am I right? But today, thanks to the collective work of so many in this room and the action by the Humboldt County Board of Supervisors, we're taking action and changing things for the good here on the North Coast. Today is a moment that came together thanks to an unbreakable partnership with the Humboldt County Board of Supervisors, local healthcare leaders who are committed to one mission: never give up, never give in, and expand our healthcare. Expand our healthcare here at home, no matter what. And thanks to so many in this room, today, that is exactly what we're doing. And yet, even as we announce major progress in expanding healthcare opportunities here at home, the contrast couldn't be more glaring. On this momentous day when we're expanding healthcare here on the North Coast and in the North State, the federal government is taking healthcare away from millions. And not only do we need to redouble our efforts to fight this action, but now more than ever, California and the North Coast must continue to chart our future forward and focus on solving our toughest problems, and we're doing just that with this announcement today. Today, on behalf of the state of California, proud to announce a major investment in the Mad River Crisis Triage Center in Arcata with a $5.5 million direct budget allocation. Here's what this investment is going to do. It's going to ensure that all 43 beds are focused on patients coping with mental health crisis or addiction and have services to turn to 24/7, 365 days a year. And this investment builds upon the investment the state of California made earlier this year at $12.4 million. And by the way, we expect this project to break ground, everybody knock on wood, break ground in the summer wanted to announce today is $750,000 we secured for Sorrel Leaf Healing Center. That is a center that's going to be focused on youth in crisis. We're going to get this project across the finish line with 12 additional beds focused on youth and teens and mental health or addiction crisis. And because of this investment, we're going to get the project across the finish line, and it builds on another $12.4 million that the state of California invested earlier this year. Let's give it up for Humboldt County. All of this good news builds on nearly $70 million. It builds on nearly $70 million invested by the state of California in the past 3 years. And this $70 million aren't numbers. The 101 beds. It's going to help thousands of youth and seniors and family members and friends for generations to come. This is permanent. And thanks to you for doing good in these past times. And I would characterize this as historic expansion. This is an historic expansion of mental health care and addiction services on the North Coast, dedicated to serving rural and tribal communities. And it also builds off one more investment that was made earlier this year, and that's to be able to rebuild Semper Virens. $43.5 million from the state for a brand new Semper Virens facility, including 16 psychiatric beds and brand new 4 crisis beds opening in 2030 in downtown Eureka. And I hope that you're with me. It is about damn time. We know some of our most desperate needs on the North Coast and in rural California is in behavioral health care. The intersection between those living with mental health disorders that often are escalated by addiction and housing insecurity. And we see this every day, and you hear about it from our neighbors every day. The reality has overwhelmed local emergency rooms and providers for years. Am I right? The increased number of homeless on our streets is because there's simply nowhere to go. There aren't enough services. And this is incredibly personal to me, and I don't mean to get choked up, but my family. My family has seen addiction firsthand. And this is personal that we get these projects across the finish line. From West Haven to Weehawken, people in our community desperately need health care that's appropriate, that's comprehensive and effective, and treats patients in crisis with dignity. So today, rather than talk about what's needed, today we're doing what's needed and building a brighter future to help solve this crisis once and for all. We're investing in projects that will continue to strengthen the local continuum of behavioral health care on the North Coast. Now let me be clear. These projects are happening thanks to amazing partnerships. And that's the way we do it here on the North Coast. Humboldt County has been a damn dog with a bone in their pursuit of developing these new expanded healthcare opportunities. And I am so incredibly grateful. I'm incredibly grateful to the Humboldt County Board of Supervisors. For those who are not up standing with us, I'm going to ask them to stand now. Let's give them a round of applause. This is what we have I want to say thank you so much to our sheriff, who sees this firsthand each and every day. Sheriff Hutson, thank you for your leadership. Thank you for all of you. We are so lucky to be able to have Connie back as the Health and Human Service Director in the County of Humboldt. We are here today because of her work and her team's work. Can we please give them a round of applause? Up here, but I also would be remiss if I did not acknowledge Amy Botza Rogers for her hard work and for their team's hard work. If you are a member of the County Department of Health and Human Services, stand up and let's give them a round of applause. Also, huge debt of gratitude goes out to Mad River. Mad River donated the land which this upon. This has been a personal mission for Mr. Shaw. I want to say thank you to you, and I also want to sing gratitude to Providence for their incredibly generous donations to both of these projects, and we would not be here without their generosity getting across the finish line today. Can we please give them a round of applause? I'm going to end it right here and turn it over to Madam Chair with this. You know, today, and again, I don't mean to get choked up, this is amazing what this community does each and every day. And this is so incredibly personal for me, seeing what my family has gone through. And let's just be candid, this has been a crisis on our streets for decades. And because of you, we're finally doing something about it. And the budget is our value statement. If we value a second chance for humans, then we're going to invest in this continuum of care. Today's proof that teamwork and tenacity here in Humboldt County makes the dream work. We are so lucky to call Humboldt home. Can we please give it up now for the chairwoman of the Board of Supervisors, Supervisor Bushnell.
That's pretty hard to follow. Hi everybody, I'm Michelle. Thanks for having me. And the county is so appreciative to work with the senator and so many community partners on this project. As we know, there is a much need for behavioral health services in our rural county. Most of us know someone who has been touched by mental health crisis or substance abuse disorder. I get those phone calls from my constituents, from those moms and dads that say, please help me with my child. Please help me with my mom. Please help me. And where do we send them? They don't need to go to jail. And I can call my sheriff and he's very reactive, but they need mental health help. And they need it right now. When a crisis is happening to your family, to your person, and you can't get it, it's devastating. And it gives me chills. Because as a supervisor, that's my job, to help people. And there's not a path right now. So I'm so appreciative that we're doing this. We want to make sure that there are places close to home that we are built for healing and recovery. We know that people recover more quickly and fully when surrounded by their natural support system. These new facilities will offer a chance at recovery right here at home with their families around them. These facilities will build out our system of care from prevention through crisis and create a lasting impact on the health of all of our residents. We are especially grateful to the Senator for his leadership in making sure that the state investments haven't left our rural communities behind. And that's so important, and he is such a champion for Humboldt County, and I can't say thank you enough. I also want to recognize that when I get those phone calls, like my colleagues do, that our behavior health team is the person I call as well. And I'm so dependent on them and their feels of not being able to have something available for people cuts them so deep. I hear it often. And with Connie and trying to really bring that here to Humboldt County and just all the people that are involved, and that's everybody in this room really. So from the Board of Supervisors, I wish to thank all of you as well. So now I'm going to introduce my colleague, or are you coming up?
You're good.
Supervisor Arroyo.
Well, thank you so much again. Just really underscoring that appreciation to you for going to bat for us. This has been a really epic investment. And I also want to underscore just how valuable the partnerships with all the people in this room are, and a lot of folks who aren't here today. But I look around this room and I see people who are doing the work every single day of helping folks who have really challenging circumstances in their life improve their lives and get access to resources. And that includes, but is not limited to, it would be almost impossible to thank all of the people individually, but some organizations and key partners include Cal Poly Humboldt, who have really worked incredibly hard to help us secure these investments and to make progress and broker the relationships. So thank you so much to you. We work really closely with local government and with community partners on matters related to behavioral health, and of course all the staff of the Department of Health and Human Services who are doing this work every day. We also have partners at College of the Redwoods and our local K-12 education system who are really working hard to make sure that we have a healthcare workforce in the future. There's a lot of really cool things happening right now to build up our healthcare workforce and ensure that there's a pipeline for folks to be able to get into these jobs and provide this care. So I'm incredibly grateful for all of those who are working in the education sector to make sure that we have a workforce to do this important and often underappreciated work in our community. So let's give a hand to them as well. You start with the shout outs, and then I'm like, I just want to keep it going. Just a few more. We have incredible partners in local government at every level, including the cities of Arcata and Eureka, as well as our other cities in the region. But Arcata and Eureka have both really worked to secure these funds as well, and to ensure that we can move forward with some of these facilities that are located in your communities. So thank you to you as well. We're really working to address the behavioral health care crisis with dignity. And as someone who also works on our county's facilities team and working closely with those in public works behind the scenes to make sure that we have facilities to place people, a huge challenge has been investment in that. And so we're here today to celebrate this. We're seeing the investment, and now we as a community know what to do. We're able to put it to work. And again, thank you to our representative, Senator McGuire. You've been incredible. Thank you for that. And I will pass it on now to Department of Health and Human Services Director Connie Beck to tell you more about the details of these projects.
Thank you. I'm so happy to be here today. Thank you, Senator McGuire. I don't want to be redundant, so I'm not going to say all the things. But I did want to touch on the 43 beds and just let you know what the crisis triage center really is going to look like. We're going to have 12 crisis stabilization unit beds, 6 for adults and 6 for children and youth, 9 mental health crisis residential beds, plus 10 crisis residential beds for those with dual diagnosis and substance use disorder and mental health, and 12 sobering center cots. We all know that hospital ERs are not the appropriate place to address behavioral health crises. Several years ago, the county and local hospitals came together to talk about the gaps in our local behavioral health system, and we asked, what would a seamless system of care look like? What do you want our families, our neighbors, and community members to encounter when there's a mental health crisis? The Crisis Triage Center is being designed to address crisis care with dignity. We're designing a healing space filled with light and calm design features. Services will include clinically appropriate level of care with stays ranging from less than 24 hours to 90 days, and discharge planning linkage to ongoing outpatient behavioral health services, social services, and housing resources. Individuals will arrive at the facility themselves or be brought there by local law enforcement, emergency medical service, mental health outreach team, clinicians, peers, or family members. They will be welcomed to a calm space built for confidentiality and dignity. They will be assessed for crisis services and triaged to the clinically appropriate level of care, such as crisis stabilization or a sobering pod. Those who require inpatient level of care will be transported to the county's inpatient psychiatric facility, which is Livereporting. For those who arrive intoxicated, medically managed detox will be available on site. Assessment criteria for substance use disorder treatment services will determine the level of treatment needed. Medical beneficiaries will be assisted in access regional drug Medi-Cal organized delivery system, and that's just appropriate levels of service in our area and other areas in the region. Mental health crisis residential and dual diagnosis crisis residential services will include psychiatric evaluation, crisis intervention, individualized treatment plans, medication support, counseling with client and supports when indicated, client advocacy, activity programming that encourages socialization, community living, and interpersonal skills for up to 90 days, as well as discharge planning. It will have special spaces for family members and peer support specialists because we know that when a crisis arrives, it is just as important for loved ones to feel supported and welcome to a calm space built for healing and recovery. I'm happy to say that with the Senator's support, the Mad River Crisis Triage Center is now in the design phase and moving forward to construction. It's scheduled to open in 2027. I want to thank our hospital partners, especially, for stepping up to this challenge with us. Mad River Hospital for donating the land that the Crisis Triage Center will be built on, to Providence St. Joe's Hospital for their community investments to fill funding gaps for Sorrel and the Crisis Triage Center. I also want to thank Cal Poly and the Director of Initiatives, Connie Stewart, for her tireless work bringing us together to really understand our system gaps and take the lead on gathering funding to make the Crisis Triage project come together. And I'll just say we had to take a trip to learn what our gaps were, and Connie kept us on task the entire time. And we really learned each other's systems really well, so it was super helpful. Big thank you to our law enforcement partners who will play an important role in making sure people in crisis access the right care at the right time, in the right place. I want to make sure to acknowledge all of our Behavioral Health Board for their vigilance in monitoring the needs of the community, lifting up gaps in the continuum, and advocating for these much needed investments in the local system of care. And I see a number of you in the audience. Thank you for being here. And lastly, Semper Virens, finally. Semper Virens has needed a new home for a really long time. The county has been searching for funding for many, many years to bring Semper Virens Psychiatric Health Facility into the modern age. The new hospital is set to open in 2030, and we're thrilled to work on this important project as well as others. I do want to thank our Board of Supervisors and the CAO. I didn't hear you mentioned. Our Alicia Hayes, our county administrator. I do want to thank you all for your continued support of improved behavioral health services for Humboldt County. I know that you sometimes hear from constituents regarding the lack of or gaps in services, and I think it's safe to say that we are moving forward with filling some of those gaps. And thank you so much, Senator McGuire, for all that you've done for us and our community. It's been so wonderful. Thank you.
We are so lucky to have Madam Director at the helm. And I also want to say thank you, Madam CAO. If there is a problem, there is one person that you call, and that is CAO Hayes. You know that it's going to get fixed, and she will move it forward. And I just want to say thank you. This is very personal to you, and of course to Connie Beck, who has been in the middle of so many, the toughest challenges that we see in our region. You can never retire. I know. We're not going to retire. We are forever grateful. Thank you so much. We are stronger because of your leadership. And speaking of being strong, we are so grateful that the Sorrel Leaf Executive Director is here today. First of its kind, the Crisis Center focus on youth and teens. We are grateful for her work, the board's work, who's also here, and Executive Director, the floor is yours.
some of you know, Humboldt County is a wonderful, wonderful region. However, it has some of the highest suicide rates in youth as well as childhood trauma. And so for too long here, when a young person has been in crisis, they have had to be shipped off to 4 or 5 hours away to Santa Rosa, San Francisco to get care. They were placed on a hold. They haven't been placed on a hold in a very sterile lockdown environment, away from their community support, away from their family. And if they were able to go outside after being pumped with meds, they would be in a cement little yard. And so Sorrel Leaf was brought up as a way to change that reality. And we know that healing does not occur without community support and without what that family support looks like. And when we open in fall 2026, first of all, thank you so much for your patience for our opening. We will become the region's first 12-bed children's crisis residential program, serving youth ages 7 to 17 that are experiencing a mental health crisis. And this is very dear to my heart. I'm also a therapist and a behavioral health officer, and I see how much the community need is for the youth that are experiencing depression, anxiety, suicidal thoughts, homicidal thoughts, and have a lot of trauma. And so we are located on a 13-acre therapeutic farm in Eureka, right off of Indianola. And we're gearing up construction. We're almost finished with the main building. And we have this beautiful healing campus vision. And if you think about it, it's the complete opposite of a sterile environment. From the beautiful facility that is very pleasing to the eye, I will say, to being inside, every youth having their own room, so being able to have a calm, safe environment, as well as having a beautiful dining area, family style, where youth and residents will be able to eat together, a beautiful courtyard that will have native plants and healing areas that have been worked on with our tribes, local tribes and our cultural council, and a greenhouse where they'll be able to get their hands dirty and plant and harvest, all alongside, individual therapy, family therapy, group therapy, as well as art, music, movement, just everything nature-based to create that sense of purpose and healing and connection to self and others that has been lost or forgotten. And so we are hoping that every element of our 10-day stay model can be replicated and that can do basically be a holistic model of whole child trauma-informed care. And this new state funding helps us build the Arts and Administration building, which is part of our healing campus and a very important part that will allow for a dedicated art studio, administrative offices, so the main building can be therapeutic and just have that space for the youth. And with this final piece in place, we're hoping that Sorrel Leaf will not only be able to open the doors, but we'll also be able to be a model that can be replicated across the state of California and hopefully further out in the States. So on behalf of our board, our staff, and families and the youth that we serve, I just want to say thank you for everybody's patience and for believing in this vision. The partnerships that we have right here, as well as in the community, hospitals, Mad River, Providence, and the donations that we also receive from the community are very, very special to us. And hopefully this will allow us to no longer send our kids out in the community so far away from the community support that they deserve. Thank you.
It is a big day. Historic expansion of behavioral health services in every corner of this county. $70 million over the last 3 years. An expansion of 101 beds dedicated to those who need our help the most. I want to once again say thank you to each and every one of you for your willingness to tackle one of the greatest challenges that rural California sees, the lack of services for addiction, a lack of services for mental health crisis. And without you, we wouldn't be here today. Finally, I'd like to thank a couple of folks. I want to say thank you to Nora Mounts, who I get to work with. list. Thank you. There is no other community that could do what we do, and it's because we rally when neighbors are in need. We stand strong to be able to fix the biggest challenges that are in our neighborhoods. Humboldt County and the North Coast is a special place, and we're here because of the team over the past many years. We are forever grateful. I think we need to give it up loud, and I think we need to give it up proud. Let's give it up for Humboldt County. We have some members of the press who are here. We're going to ask each of our speakers to be able to come to the side, and of course, we're going to answer any questions and comments that folks may have. But before we do that, we're going to ask everybody to come forward. We're going to take a large group photo, if that is all right with everyone. The CEO says no problem. All right, so I'm going to have everyone come on forward because we want to make sure that we get this team shot. Come on up.
Okay, as they assemble for a group photo here, we're just going to take some B-roll, observing the process as they file in the movers and shakers of Humboldt County. You're tall. You have to be in the